You touched on it a little bit, Dr. Bob, but isn't it kind of a chain reaction? Once you get on a drug, you possibly get a side effect and you take another drug. I mean, so once you get started, there's really no going back, isn't there?
You know, you're absolutely positively right. One medication has 10 bad effects. Now, recently we had someone that passed away from a drug interaction with a challenge. And it's very common in people who are entertainers that take a lot of medications for whatever reason. They have a lot of pain in their body. So I watched a program, and there was a medical toxicologist that said this: when it comes to meds, 1 and 1 is not 2. 1 med and 1 med does not equal 2. 1 and 1 equals 5. And the point he was saying is it's exponential. So I know from my own research and reading other people and listening to what they're saying, 1 med has 10 bad effects. 10. 2 meds have 100 exponentially. 3 have 1,000, 4 10,000, 5 100,000, 6 a million, 7 10 million, 8 100 million. 9 meds. If somebody comes in my office and they're taking 9 meds, they have a potential to have 1 billion reactions going on. My highest amount that I had, one patient came in, 23 meds. Now I'm going to say something to you right now that's going to make you cry. My little boy came in, 4 years old, ready for this? 14 medications. 14. You know what his challenge is? He's a son, obviously, lives with his biologic mom. Biologic dad lives out of state, sees him periodically, but every time he sees this young boy, when I say periodically, he happens to be a pilot, so he flies in a lot, he lets him eat with reckless abandon. And see, food can alter or compromise function in the body. It's amazing when you start tying all this together. This is how much sugar is in 1 soda. That's 9.5 teaspoons in a 12-ounce can. Sugar paralyzes the immune system. 1 white blood cell will eat 14 bacteria in a half an hour. When you give it a can of soda pop, that white blood cell only eats 10. If it has a brownie, it goes down to 5. Piece of pie and ice cream goes down to 1. So there are people right now that have chronic upper respiratory infection and don't even realize that it's the sugar that they're eating that's compromising immune system function. So every time that dad flies in, gives that little boy whatever he wants, that sugar compromises function. So he's taken 14 meds a day. So we could backtrack all that. If we could just convince the dad to make these changes, his son won't have health challenges.